thank you everybody for joining us today at this special Seniors for Social Action Ontario event. We're always delighted to introduce people who participate and play an important role in their communities, which Gerry certainly does. And she's a member of the Upper Madison Life Committee. That's a committee created by a group of volunteers who live at 100 Upper Madison, and that's in North York. Their goal was to create social networks within their buildings to assist elders as they age. And this is a wonderful model because it can be implemented all across Ontario. It doesn't just have to be in buildings, it can be in neighborhoods as well. So that it works in apartments, condo buildings, as well as residential communities where a high proportion of older adults live. And what's great about it is it's also intergenerational. It involves everybody who wants to be involved. So with all of that, I just want to welcome Gerry Gryba, and I hope everyone else welcomes her. We can all put our hands up and cheer now. Okay, Gerry, over to you.
Okay, well, thank you so much. I really want to thank Seniors for Social Action Ontario for giving us this opportunity to share our experience. And I'm sure that we can also learn from other folks' experience too out there. So I think the sharing at the end is going to be really valuable. So I guess without further ado, I can't see the slides. Are they up or?
We'll get them up right now.
We're putting the slides up. Thank you very much. Okay, so now I see a whole, oh, there we go. Alrighty, that looks better. Okay, so aging in place at 100 Upper Madison Avenue, North York. That's what we're all about. If I could have the next slide, that'd be great. Okay, so just an overview of what I hope to cover today. First of all, I thought I should at least tell you where we are, especially for you folks who aren't in Toronto. Then talk about how we got started, where we are now, and our long-term goals. Next slide, please. Okay, so where are we located? We're in North Toronto. We're just north of the Yonge Sheppard subway station and the 401. As you can see, it's a pretty concentrated area of high rises, but actually lots of green space around us. So it's a great place for active senior citizens to age in place. I can walk to several grocery stores. I'm looking at LA Fitness right now, Longo's outside my Winners, the Bank of Montreal. So I can walk to all kinds of stuff. I'm just up the street is Mel Lastman Square, where in the summer we have a farmer's market. I'm connected by subway if I want to go to a Leafs game or the Art Gallery of Ontario. I just jump on the subway. So anyhow, I guess I could go on and on about why I love my neighborhood and why I like living where where I am living. So the challenge is, so what happens next? What happens when I'm not an active senior? What does that look like for me? And I guess that's kind of a segue into my presentation. So next slide, please. Okay, so how we got started, it's kind of an interesting process. My husband's a great reader of newspapers and was reading the Toronto Star one morning in November of 2022. And he says, "Gerry, you got to read this article." And I'm like, "Yeah, all right, whatever." And he gives me a hard time now because he said, "You know what? It took me 2 weeks to get you to read that article." Anyhow, once we read it and we started sharing it with people in our building, we have a coffee group. And you know, we thought, wow, this is pretty cool. So it's basically the article talked about, as you can see, I think, you know, we've got, what do they say? Natural retirement communities, why these high park condos could succeed where many have failed. And that was pretty compelling. And you read the article and it's like, okay, just creating social connections makes seniors healthier. You have less falls, you're less admissions into hospitals. So, you know, it seemed like a step in the right direction for us. And so we pursued it. We chatted about it very informally around our coffee group in Wednesday mornings and started to do a little research on the University Health Network and their NORC initiative. Now, for those folks who aren't familiar with what NORC stands for, it's a naturally occurring retirement community, which by definition is, I guess, over 30% of the residents are over 65. And in our building, we just meet that criteria. Okay, I guess we'll go on to the next slide. So I would really encourage folks to go on the UHN's University Health Network's website and investigate what this program is all about. We use their, maybe I should just step back a little bit here. At the time, in November of 2022, they were giving out, I think at the time there was 5 $1,000 grants to start a NORC program in your building. So we were pretty enthused and we applied for that grant. We didn't get it, but at the end of the day, by that time, we were so convinced that this was a good idea that we really decided to do it on our own. And this guide, Welcome to Your Aging in Place guide, was basically our roadmap. And we really used the stuff in that guide, especially their idea book, to generate things that we thought would work in our building. And from that, we developed a survey. And we were very fortunate that when we didn't get $1,000 grant from UHN, our board stepped up and said, yeah, we'll support this initiative. So that got us up and running. Okay, next slide, please. So this is kind of an interesting thing. I was kind of ambivalent about having a mission statement. It's like, well, whatever. But we really decided to follow their guidelines fairly carefully. So we developed a mission statement, and actually, I think it's really helped in terms of keeping us on track as to, something had come up and it's like, well, let's revisit our mission statement and does that really fit with what we're trying to do? I mean, I could read the mission statement, but I think you guys can all read the mission statement. You don't need me to do that for you. And we really basically just took that out of their guidelines. But we did add one important component, that we are inclusive to all residents, not just seniors. And as it turned out, that was pretty important. Okay, the next slide, please. So our approach. So as I said, we took their ideas book or whatever, and just chatted again about it. And it's like, so what would probably work in our building? What should we ask residents that they would like to see us do? And this is also another important component of the UHN initiative is it really has to be driven by the residents themselves. There's no point in us saying as a group, oh, we're going to have a bridge club, come and meet us on, whatever. If there's no interest in a bridge club, that's not really how they recommend you approach it. And that's been our experience. It really is important that you get feedback from your residents. So with the assistance of the board, they stepped up and bought refreshments and whatever, and we had a launch party after we conducted the survey and did a little analysis. And our property manager, great gal, put this little invitation together that went out to everybody in the building. And what we did at this launch party is basically, by that time we knew, okay, so many people were interested in movie night, or so many people were interested in an investment group or whatever. We said, okay, if you're interested in movie night, you go to that corner, and all of you folks in that corner decide what movie night is going to look like. And interestingly enough, movie night is kind of an interesting example, because the two people that took the lead, one is really into documentaries and the other person is into classic movies. So they rotate, and again, it's an example of, okay, you guys decide what you're going to do with that group. So yeah, that's been successful. Next slide, please. So we call ourselves the Upper Madison Life Steering Committee. We want to be seen as inclusive to all residents, not just seniors. And if you get nothing else from this presentation, this is something, if you're launching this kind of initiative, you need to pay attention to. And we really were just kind of lucky. when we started out, it's like, well, okay, we're the aging in place people at Upper Madison. Why don't we call ourselves the Upper Madison Aging in Place Committee? And then, well, you know what? We already have a Facebook page that's called Upper Madison Life. Why don't we call ourselves the Upper Madison Life Steering Committee or whatever? And the optics of that are tremendously different. As soon as you start referring to yourself as aging in place, it's really difficult to get, like if we've got 30% of the building is seniors, what happens to the other 70%? And how difficult would it have been for our board to support an initiative for 30% of the building? And, when you're having an event, if the other 70% aren't included, then you start to get the chatter, oh my God, we're starting to look like a seniors home. So it's important that how you message this, folks. And it's interesting because now I'm sure if you ask people in this building, so what's the Upper Madison Life Committee? And they would say, oh, they're the people that organize social events in the building. So obviously, if there's more social activity in the building, it's good for everybody. And as seniors, we benefit just, by default, I guess. Anyhow, that's my little grandstanding there, guys. So, but pay attention to that. Okay, next slide, please. So how do we operate? Some of this I've already covered, but maybe just to re-emphasize, our steering committee is an oversight committee. Each group is autonomous, picks a leader, and decides what their group will do. We canvass residents for ideas and help them get started. We provide advertising. Our property manager has been great. They send out a monthly email where we compose what we want to tell the residents in the building about the activities for that month. And then we have a lobby TV where it'll scroll through what our events are. We use Facebook. And we hold regular meetings with a rotating chair but a dedicated recording secretary. The rotating chair, I think, is a good idea because it gives everybody a chance to lead the discussion and set the agenda. And I think it just creates a better dynamic within the group itself. And the dedicated recording secretary, we felt that was where, you needed some consistency, and the person that does that is very good at it and does a really good job of keeping us on track. Now, I highlighted this last item. Again, it's something that came out in UHN's guidelines, but I think anybody who's lived in a condo knows how easily it is to get into confrontations with the board and residents, and it just can, it can spiral in a direction you never ever thought it was going to go. We had an incident last year where we had mold in hallways, and then we got into a debate when it needed to be remediated. Do we paint the walls? Do we put up wallpaper? And if you've lived in a condo, you can pretty much guess where that conversation went. So we've been really, really vigilant about not getting involved in any issue that the condo has a mandate to manage. We're just helping people get together and have fun. We're not talking about wallpaper. I guess that's the bottom line. Anyhow, next slide, please. So the key to our success, I think, as you probably already gathered, we have exceptional support from our property manager. She was on board from the get-go. The condo board has also been very, very supportive. I think it was helpful with the condo board. We went to them and asked them, well, would you like us to do a presentation about aging in place, about the NORC initiative, about what we're trying to do? And fortunately, they were responsive to that. And once we did the presentation, it was an interesting dynamic because when they first came into the room, they came in as a group. And you could feel the tension because in most condos, if a group of residents get together and start meeting on a regular basis, it can cause a lot of problems with the board. They can see it as competition, and so they were nervous, and rightfully so, because it can go sideways. But once we understood that they had the mandate to manage the building, and we really have no mandate. We're just volunteers. And by the end of the meeting, the dynamic had changed phenomenally. They were making suggestions. Well, have you guys thought about doing this? This might be a good idea. And, so it was great. It was really great, that conversation that we had with them. So I guess my argument is, communication works both ways. You've got to be talking to people on both sides, on all sides, I guess. And then obviously we have a very dedicated, energetic group of volunteers, which, the shout out to Mike and the gang. I'm not sure who's in the gang watching from our party room, but a big shout out to the folks on our steering committee that we work very hard to make this happen. Next slide, please. So where are we now? We have a Facebook page with over 110 members. This is important for us, but it's also challenging because there's a lot of people, rightfully so, that are very nervous about social media. So we really aren't reaching people in the building totally the way we'd like to. And that's something that we're going to, we will be working on, I think, as part of our next tranche of initiatives. And then we do have a contact email. So if people want to, initially, people were giving out their personal emails, and the reality is, you don't want your personal email out there, I don't think. Anyhow, that was the decision we made. Next slide, please. So just a kind of an overview of some of the things that we've done. As you can see, we, at a holiday party in December, summer parties, fall party just this last month. We've also sort of wound in the concept of a birthday party. So last month, in September, the board pitched in and we bought a cake and celebrated people with September birthdays. And it's kind of cool because sometimes a kid will show up. It's their birthday. So it makes it inclusive to the building. Next slide, please. And we, again, part of the trying to be inclusive, we've held a children's party. As you can see, it was the Valentine's Day was the event, and we're just doing a trick or treats this Friday. I believe it's Friday, is Halloween, in the lobby where we'll give out candy, and we have a big backdrop that they can get their picture taken if they want. So we're trying, again, part of the inclusivity type of thing. Next slide, please. So these are the active groups that we have right now. And some, let's face it, not everything's a success. I would say these are the ones that have gained traction and are successful. Some have more members than others. But anyhow, it's got to the point where one of our challenges is we have enough going on that booking the party room becomes an issue. So yeah, it's pretty great, I would say. Next slide, please. And then we wanted to do a speaker series. So as you can see, we did something about climate action with the Young Corridor Association. I guess I can never remember what all the acronyms stand for. And obviously that's of issue to everybody, no matter what your age is. We did, obviously, Toronto Police is about safety, a first aid training where we did stuff. We have a defibrillator in the, well, at that point, it was sitting in with security and, it's like, okay, so it's in the building, how do we use it? So that was a worthwhile activity. And then we had North York Senior Center come in and do a presentation. And then all of the things that we've done, that presentation was really the only one that you would say, well, obviously it's directed towards seniors. But the feedback you get from other people in the building is, well, gee, that's kind of great. They got people in that are talking about how to help seniors in our building. That's a good thing. So again, sometimes it's how you present things. Next slide, please. Now we do a newsletter. This has been a challenge for us, quite honestly. It's a lot of work. It's well received. We're struggling with, what to do with that in the future. But, sometimes you create something that's like, well, that was well received, and then you got to keep it going. We were trying to do it quarterly, but, it was a challenge. So that's something we're, revisiting, but something that's actually been pretty popular. Next slide, please. So then we thought, well, maybe we should circle back. and see how we're doing with the folks in the building. Like, what do they really think about what we're doing? So you can see I want to point at things, but I can't. But on the right, we had a big display in the lobby with all our posters and what we do, and then sort of the questions we wanted to ask. And obviously the big one is, we want your opinion. Now you'll see on there that there's a QR code. We also had a link to the survey. So this is all online. And obviously, QR codes, links, you have to have a certain amount of technical knowledge to use that. So, it's getting people up those learning curves. And we obviously we said to people, well, if you're not comfortable with that, we have a paper copy, and we'll enter the results for you, and they became part of the database. But we were certainly using QR codes quite a bit, and really trying to get people comfortable with being online and using some of the stuff that's just a reality of our life right now. Anyhow, the next slide, please. So I thought I would present, this is hot off the press, folks. This is stuff our steering committee meeting tonight, we're going to discuss the results of our survey. So I was lucky that there was enough time that I was able to insert, there's 4 slides out of basically a slide deck of 25 slides that it analyzes the results of this survey. So, it's a lot of information. Now, it was pretty simple to complete. The survey was really, it was not onerous to complete the survey, but I can't exactly remember I think it's called Google Forms, but it's a Google platform that once you get the information into the database through an Excel equivalent, I guess, or anyhow, analyzing the data, it becomes incredibly powerful. And like this graph, you look at it and right away certain things pop up to you as to, okay, what people really like about what we're doing. Obviously, the big blue block towards the right there, those are our parties and barbecues. People love those. So obviously that's something we're going to continue doing. Now, the genealogy group, not so much. So, okay, well, that's probably something that, is going to go by the wayside. So, it's going to be an interesting conversation for ourselves tonight at our meeting, to sort of do a deep dive on some of this stuff and what is it really telling us. So the next slide, please. So tech support, again, as I was saying, this is just a reality in our life. And the more, for seniors, this can be a challenge. So it's gratifying. When I looked at this, I thought, wow, there's 14 people in our building that are willing to provide one-on-one support to other folks in the building. So now, we only have 11 people that said yes, they would use it. But I'm guessing that, obviously we're not reaching everybody. But we know we have a group of people that they're willing to help us with this. So that's great. Next slide, please. So now, and this is an interesting slide, because one of the things that we quiz people about, we wanted to start an initiative called Neighbor to Neighbor. And we sold it as, initiatives that would help build a sense of community within the building. But the subtext to that was really, okay, so how do we support seniors in the building? And so again, we've got 16 people that want to do that. And we've only got 2 people that said, yes, they would use that service. Does that mean we should abandon it? Probably not, because the people we really want to reach, they probably don't have a laptop or a computer or an iPad, or highly unlikely they know how to use a QR code. So, how do we reach them? And that's a challenge, in a building like this, you've got issues of privacy. I'm guessing if, our property manager and security have a pretty good idea, certainly who's using personal support workers. But how do we reach the people that really could use the friendly visitor? And I don't know. We're going to have to do some brainstorming around that one. That's for sure. Now, another item on that, obviously, is when you're going into somebody's home as a volunteer. We're looking for training for those folks. We've reached out to the Circle of Care and the North York Senior Center, and they will provide us with training for those, 16 people. I think it's 16 people or whatever, so that you're because there's obviously lines you don't want to cross. So yeah, anyhow, that's again, we got to figure that one out, but we certainly want to do it. So yeah, some questions around that one. Next slide, please. Again, so this, again, as I said earlier, we're really struggling with our newsletter. We know people like it. We have a gal in the building that she kind of does this professionally. And, man, it's a great looking newsletter. Let me tell you, it's very professional. It's whatever. But again, it's a lot of work. But now when you do the survey, you find 30% or 34% of the respondents, which I did the math, is about 15 people, want to help us with that. It's like, well, okay, there you go. How do we make that work? But at least we know we have a group of people that are willing to work on that. So, these surveys can be incredibly useful, powerful tools to help you figure out what you're doing in your building that's right, what you should do differently, what you maybe should forget about, or whatever. Anyhow, so next slide, please. So this is the one I really like, because this is the one that we ask people, what do you like about what we're doing? I won't read all of them, but when you're talking about creating a sense of community, one that I think, we need to learn from is I think it's amazing how many fun activities there are in the building. It's wonderful. I definitely have been meaning to check them out, but I guess I don't know anybody. I'm a bit nervous. So, it's kind of like the 7-year-old with the first day of school, or the 70-year-old walking into a room full of strangers. How do you make people feel comfortable? So, again, you try to figure out ways to be welcoming and whatever. But obviously the one I like the best is the one I highlighted. We get together as a big family. And you feel the difference in the building just because people are more socially engaged. And it's not the majority of the building. Like, we've got about 500 residents in this building. I would guess, if we're lucky, our barbecues are our most successful event. So we might get 50 people out for that. But just the folks that are participating change the dynamics in the building, and I don't know, it's just a nicer place to live. So if for no other reason than that, it's great to come home to this building. And instead of people being nervous about, it's because the thing you hear from other folks in other buildings is their boards are nervous about these initiatives because they don't want to be seen as a seniors building. They think it's going to hurt their property values. That's the bottom line. Now, if you can market your places, we are a really friendly building. We are a great place to live. How's that for a marketing strategy to sell a condo in a building? I don't know. But anyhow, obviously I'm prejudiced, but it's working well for us, I guess, is our bottom line. Okay, so the next slide, please. So obviously, there are some challenges. I've already alluded to. One is reaching out to seniors that, we know we're not reaching. So that's a challenge. Also, we're a very diverse building. So this neighborhood is known as Little Korea. And there's folks that, of various backgrounds that just don't show up to our events. So how do we reach them? And it's interesting because when we first started this, I guess 1.5 years ago, the property manager had an assistant that I think she spoke Mandarin. Anyhow, just translating our holiday invitation into Mandarin, all of a sudden you got a different group of folks. Felt welcomed because you were reaching out to them on a level that they obviously could identify with. But, obviously that's a lot of work. So it's, there's these things are not without challenges. I guess obviously the one I didn't mention on here is, as we've become more successful, just booking room in our building. We have a party room. We have several other kind of quasi-meeting spots, but we're getting overbooked, which is a good thing, but it is a challenge too. Okay, next slide. So where do we go from here? And I will read these through. I'm not a big fan of reading off of slides, but I will read these. So we're actively looking for partners in the health sector to work with us so our seniors can successfully age in place. We are starting a new initiative, Neighbor to Neighbor, where residents provide assistance to others in the building. A lot of resources are online. Our volunteer tech group is helping seniors improve their technical skills. We'll help seniors access resources in the community. We'll continue to canvass building residents for their input. And then this is a reach out for anybody. I'm hoping in the Young Corridor, Young Shepherd area, in the other high rises around us, there are 6 NORC condos within 250 meters of the Young Shepherd subway or that intersection. We'd really like to get into contact with anybody that is either in those buildings or knows somebody, because the reality is we're 170 seniors at 100 Upper Madison. Those 6 NORC buildings have 1,000 seniors. So where's the voice? The voice of 170 people, but 1,000, maybe somebody will listen to us. So hopefully you folks will reach out to us if you're out there. Anyhow, next slide. So there's some really good resources in the community that who knew? I did not know this a year ago. The North York Senior Center is a phenomenal resource for seniors in North York. They run a whole bunch of services because they service a bigger area. They're doing a lot of the things we'd like to see in our building. They're a bricks and mortar building 2 subway stops away from us. They've been in business for 50 years. So, you know, they might be good people to partner with. So I don't know. We're in early stages yet, trying to beat the bushes to see who's going to be a good partner for us. And I put up this other slide, a directory of services for seniors and caregivers. Now, up until 2 years ago, the City of Toronto published this as a book. It's 140 pages. Now you can only get it if you can click on the link and you have a computer. And it just seems like, oh man, you know, how are you helping seniors when the first barrier you put up for them is they can't get the book? So again, we will work at getting that information to the seniors in our building. But, you know, I don't know whether you would call that ageism or just, you know, you don't get on the priority list of city council or whoever makes the decisions as to what publications actually get printed. I don't know. But, you know, it's little things like that are frustrating. Okay, next slide, please. So I don't think it's any surprise. This is our ultimate goal. Our success in getting there, I don't know. You know, integrated on-site healthcare and other services necessary for seniors to successfully age in place. So stay tuned, I guess. And the last slide, I think is the last slide. Yeah, this is our business card. That, you know, we try and beat the bushes and get people to join our groups. And I mean, I think it's self-explanatory. So basically that's the end of my spiel. My husband was after me. He said, "Do not forget to mention the dogs." Now that we are a very dog-friendly building, and it's interesting because actually dogs have been a component of building a sense of community. I think anybody that, it's like I'm on the 19th floor. If I ride up the elevator and I'm by myself with somebody in the elevator, the chances of having a conversation are not great. If I'm with my dog, almost inevitably somebody will say, "Oh, what's your dog's name? Can I pet your dog?" Yada, yada, yada. And all of a sudden you have a conversation. So yeah, well, dogs were important. Okay, well, thank you very much. I really, really appreciate this opportunity. And yeah, if you got any questions, I'll try and answer them. Or my group, I'm sure at some point Mike would be more than willing to be off mute, and there's folks within our group that can answer some questions. Certainly, our survey, we're very, very fortunate in having a very tech savvy person, and we would be more than willing to share our survey. And obviously, you would have to modify it for your own, your own particular situation.
Thank you, Gerry. This is great. And yes, we want to open it up for questions that people might have or conversations that people would like to have. If you check your React button, you can put your hand up if you'd like to ask something, or you can ask questions on chat. And I will be taking a look at those, and people who might want to make comments. I see there's one there now from Mary in Sudbury on chat. So I will be making reference to those throughout. But if you do have questions, by all means, ask them. I just want to point out one of the things that's a real strength with the whole NORC model, Gerry, that you really highlighted well, is you're laying the groundwork for future development of things, which is really great. And what that means is that each NORC can tailor its activities and what it gets involved with to its own residents, which is really fantastic. Because not every building will be interested in certain things, but like in other areas of Toronto, I know for a fact that most people would sign up for Mahjong, even though they're not interested in your building. So those are the kinds of things. And as you pointed out, friendships are made during these kinds of social events. And that's how we build social support, which is terrific. And we need to build more community. And so maybe we can start off with this. I'm feeling as if after the pandemic, especially, people became quite disengaged. And I think it showed up a bit in your survey with 64% saying not interested. And I do wonder how much of that even has to do with depression, where people, they became isolated and they got kind of depressed, and now they don't have the energy to get involved in things. So even having some mental health support available to people might be useful. But what are your thoughts about that, about, people's level of disengagement now?
You know what, I think, well, I guess it was John, is it Lord's last presentation? And, it's kind of like if people want to drink tea and eat toast and sit in their condo by themselves, there's only so much you can do. And you have to respect where people are at certain times. I guess the other thing that I say to people, you can lead a horse to water, you can't make them drink. But, at some point they might get thirsty. And they might say, oh, wow, that looks cool. Maybe, it's like some of the survey results we have, I haven't engaged yet, but I might, and so when people say, no, I'm not interested, it may be not so much that they're, that they just don't want to play Mahjong. It's not that they're not interested in something else. I don't know what to say about that. You try and be as supportive as you can and as inclusive as you can. And you're right. I think the pandemic did a number on all of us. I think you have to be patient. I mean, when the first group that we started long before NORC was our book group. And boy, it was a battle initially to get that off the ground. Last night we had a meeting and we were trying to find chairs. So, it takes time for things to sort of gel, and you have to be patient. And don't give up. If somebody doesn't show up for something, obviously analyze why you think they didn't show up. And at some point, we tried a bridge group. Well, that didn't work. And you would think, well, bridge would be a pretty logical thing. And for a variety of reasons, we had people that were experts and we had folks that were learning, and it wasn't a good mix. So it just didn't take off. So I don't know. You celebrate your victories, I guess.
Well, exactly. And you do what you can, which I think is important, because a lot of people aren't doing what they can. So you guys are, and you're building something that I think is really valuable for your community.
The only other thing I would add is don't discount personal touch. If you like, I hope we have a pizza party tomorrow night if we get enough responses. But don't discount when you get on the elevator with somebody. Say, hey, are you coming to our pizza night? And sometimes just that personal outreach, the person who's afraid to come because they don't know anybody,
Right.
it's like, oh, are you going to be there? Oh, yeah, sure, I'll be there. Well, then they know one person. So don't discount the reaching out to people and just asking them, are you coming? What, can I, if they're an older person, can I come and help you get down to the party?
Right. Right. No, that's excellent, because breaking the ice is hard for a lot of people, Not
Absolutely.
everybody's an extrovert. Okay.
Oh, for sure.
Karen Beatty, you had a couple of questions. Did you want to ask them to directly, and unmute your microphone if you do want to ask them? Karen, are you there? Just looking to see.
Yeah, thank you. Great presentation. Thank you so much. So my questions, I had two questions. The first one is family members of the seniors who live in your building may become caregivers for those seniors at some point in the future. So involving them at an early stage could be really helpful and really could help to spread the news about what you're trying to do there. So I just wonder if you have any targeted outreach methods to get in touch with those family members. And then I had a second question. Do you, or does anyone who's on this call right now have any suggestions or thoughts on how this particular model could be adapted for more rural settings? Thank you very much.
Yeah, your first question, I guess really that's something we really are struggling with. And I actually, if there's anybody in the audience that has any recommendations as to how to reach either the families or the individuals involved that we know need more support, I'd certainly love to hear them. The second one, in terms of rural communities, interestingly enough, my husband and I were traveling with our trailer this summer and met a guy from St. Andrews by the Sea in New Brunswick, and they've got a NORC where they're working on, and I guess the provincial government there is supporting a program called Nurses Without Walls. So I mean, it really is up to the community of seniors themselves to. There's no reason what we're doing can't work anywhere, as far as I can see. But it is taking the initial step, and you like we started with our coffee group. You got to start somewhere.
You have to start somewhere, and I think that that's perfectly reasonable. And coffee groups aren't a bad place to start.
Yep.
It's fairly informal, not
Yep.
too threatening, and people are more likely to come. So, and plus it's free food, which is great. Okay.
Well, I would say too, to anybody, especially in our neighborhood at Yonge and Shepherd, I mean, if you think it would be beneficial for folks from our committee to come and talk to your coffee group or your manager or your board or whoever you think would help you get this up and going, we're more than happy to come over and do a slide presentation or send you a slide presentation or whatever you think would be useful to you. Give us a call.
Yeah, that's great. And you gave us a Gmail address as well.
Yeah,
People from all over Ontario can contact you. So
it's a Gmail account. So again,
Zoom is available.
Happy to share our experience with anybody. Obviously, the personal touch is easier in Toronto.
Right.
Somebody's willing to fly me to Vancouver, I'd be quite happy to do this.
Isabel, you've had your hand up. Did you have a question?
Yes, I'm very interested in the fact that people age in place, but they reach a point where perhaps they need some sort of support, physically, mentally, whatever, socially. But you mentioned that you are going to approach healthcare providers in some manner. Do you have any tips in whom and how?
We're at early stages. We've had a little bit of conversation with the University Health Network in terms of folks they think they might be able to connect us with. It's early stages for us. I guess that's why we wanted to circle back and do another, survey, because we're really ready to move to the next stage. And to be honest, I don't know what that's going to look like. Again, in the North York Senior Center, which I mentioned earlier, they've been up and running for 50 years. I mean, maybe there's a way we can partner with them. But, at the end of the day, for us who are privileged enough to have financial security, the resources are out there if you're willing to pay for them.
Right.
And the tragedy is, or the challenge is, not to do a deep dive into politics, but, when you have a government that would rather build bricks and mortar places to warehouse people than to help people age in place, because it really is about money. I mean, it's not rocket science. I mean, if they can do it in Denmark, where apparently they haven't built a new facility since 1988,
Right.
we got models out there, people. We don't need to study this to death. We need political will.
Yeah. Thanks so much for saying that, Gerry, because that's exactly what we have found right across the province is it doesn't take a lot, but there's no investment in the community. There's only investment in the bricks and mortars.
Well, and I think back, talking about, it's a great place where I am right now as an active senior to live. I love my condo. I love my neighborhood. But, there's going to come a point where changing a light bulb, I'm not getting on a ladder anymore. So, if I'm isolated and I don't have anybody to change that light bulb for me, I mean, I watched this with my mom and my mother-in-law. You just get to a point where you're done. I'm
That's
tired
right.
of fighting the things that I can't do anymore. I guess I have to move. And when you think about changing a light bulb, if people are moving because of the simple things, that it's a tragedy.
It is a tragedy. And 69% of people currently in nursing homes have no significant disability. We have those figures from the Ministry of Health. So you're absolutely right. They shouldn't be there at all.
Exactly.
Not that anybody should be, because if the support is there, they don't need to be.
No.
Yeah, exactly right. And by the way, Isabel, we have heard from others who've started NORCs that pharmacists are fantastic resources, that the pharmacists will
Yeah.
come in and they'll talk about medications, but they also know all the doctors, and they know the doctors who are more community oriented.
Well,
So
that's a good point.
they can say, maybe you should call Dr. So-and-so. And Kaylin Campbell, are you still here in the session? Because if Kaylin Campbell is still here, she's one of those wonderful community-oriented doctors, and I'd love for Kaylin to comment if you are here. Kaylin, I want to give you a chance.
Hi, Trish.
Hi, comment, please.
Yeah, I'm a care of the elderly physician working in Brantford area. But I think, yeah, there's so many community programs that are already providing support to seniors in their homes. So if you can kind of find some, and I know in Toronto, there's a lot of home visiting programs to connect vulnerable seniors or more frail seniors, also through the University Health Network. So I think there'd be a lot of potentials for partnership with those kind of programs to help people continue to age in place.
Yeah, exactly. And there are, I mean, you may even have members who have some really great family physicians who may come in and just, do a session even for people. Because one of the things we find is with SSAO is if we have a doctor come in and do a presentation, tons of people sign up. They want to hear from family physicians especially. So I'm just noticing hands coming up. So let me just look. Lois Brisboy has a question. Then we're going to go to Jean Brady, who has a question as well. And I will look for anyone else who has a question. So Lois, you had a question in chat. Did you want to ask Gerry directly? You need to unmute if you're muted. So Lois, one more chance and then we'll go to Jean. Okay, I'm going to ask Lois's question because it's a good one. She said, how did you get your property management to let you take these initiatives? She missed the first 10 minutes. So she says there's controls who can contact who. So
Sorry,
she-
there's some
she
folks
says-
that,
she says that their property manager controls who can contact who. So how did you get the property manager to agree?
well, we're very fortunate. We have a property manager that, and when I first floated this idea to her, she was just 100% on board. So, we were very lucky. I'm not sure if the question regarding was when you controls who comes in or,
It- She says the property manager controls who can contact who, which is really,
well, you get into issues of privacy. Our property manager has been very generous in using the condo email system, which they have, to get some of our stuff out. But then she got pushback from residents in the building and said, no, I don't want to get all this stuff from Upper Madison Life. So then we had to rejig
up a little. Yeah.
how we were putting information out. So we instead of sort of doing stuff throughout the month, we do it once a month with sort of a summary of what we're going to do this month. We're looking at building our own email list to do contacts. So once people give you their information, I have no magical answers for property. They're people. They're either with you or they're against you.
Yeah.
And we were so fortunate because she also had the attitude. Because a lot of times, the attitude you run into is, oh, our board will never let us do that. And in some cases, they're right. The board's not going to budge. But in some cases, it's like, well, have you asked them? And, and our property manager was like, you know what? I don't ask. If I think what you're doing is okay, I hope nobody's listening that shouldn't be. But, she's just a very sort of supportive person. And so again, I mean, between her and our board, we wouldn't be where we are today.
Right.
Without them.
Well,
and how you have to try and find champions, I guess, within your building, whether it's a board member who you think might be supportive that you can approach one-on-one. I really don't know.
Yeah,
I mean, we've certainly had other property managers that, definitely wouldn't have been supportive. So it's kind of the convergence of just a lot of great things at the same time.
And
I mean, if we'd never read the article in the Toronto Star, or my husband had never read the article in the Toronto Star, we had no idea what was going on out there.
Exactly.
It's like there's a whole whack of stuff going on out there.
Exactly. Well, and some people in the building may be friends with a property manager and they may be more amenable to them if they approach them. So,
well, that's true. That's true. I mean, interestingly enough, the way our property manager looked at it was, wow, if you guys are going to take on all the social activities, there's one less thing I have to worry about.
Perfect.
And ultimately, it was kind of the board's attitude too. I mean, our building was built in 1988. We got issues. They're very, in my opinion, very well managed by our property manager and board. They don't want the diversion of doing a children's party. Let's face it.
Yeah, exactly.
So, it's trying to find the win in it with them and a way that they don't feel threatened. I mean, the only issue we had with them was we thought, well, gee, wouldn't it be a good idea if we had sort of a repository of, contractors and whatever that people have had good experience with in the building, the personal recommendation thing. And, it's the board and the property manager said, you know what, we ran it by legal and it's like, too many liabilities associated with that. We're not prepared to support that initiative.
Yeah.
And at that point, we kind of took the attitude, well, if they're not, if they see a lot of liabilities, we probably shouldn't get involved in it either.
Exactly. But
it doesn't mean that, by word of mouth, I don't tell my neighbor, oh yeah, I had this plumber and he was really good. But
exactly. It'll happen anyway.
Yeah, for sure.
Yeah. Jean, you have your hand up. Question?
Yeah, just a couple of things. My friend and I here live in the building next door to the Madison. It's called 131 Beecroft Manhattan Place. And
okay.
pretty much everything that Gerry has been speaking about, we have had in place for a number of years. We've never considered it NORC, but just that, you know, we have a boot club and mahjong and exercise classes and the swimming aquavit and what have you. We have coffee mornings only once a month, and we have online discussions once a week. I'm curious about two things. Well, also I should say recommendations for local service providers. We have via a Google group, which is nothing to do with the board. It's a Google group that's run by one of the men in our building, and he just collects information and shares it purely on a volunteer basis. You can join the Google group and get access to his list. And I know he's got everything on there from pedicures and manicures to electricians and travel information. And so he collates that for us, which is very, very helpful. I'm curious about your coffee mornings. We have one once a month in our boardroom. We don't have to pay for the use of any of our facilities, so that's kind of handy.
No, that's true.
We can rent them. We can book them online, and we get in there and we can use them whenever we wish. We've got a party room and a library, and also a small party room. So space is fine. But again, to get back to your coffee mornings, so we do them once a month. They've been going on probably for 20 years, once a month. We charge $2 for coffee, and I personally would like to make that once a week. And I'm curious how often yours are and what kind of turnout you get, and whether or not it's what we say is bring your toonie and your mug. You have like a catchphrase. How do you run your coffee mornings?
Well, it's a couple of things I would say there. You have to remind people. We have a Wednesday morning coffee group that at this point we need to do a reboot. We have a conversation group on Thursday night, and it's successful basically because Mike, the guy that's leading the conversation from our group here at Upper Madison today, he puts out a message every Thursday. Remember, folks, tonight is conversation group, and if you don't put that out, people quit coming. So you need a dedicated person that reminds people. And the reality is, we just do. You know what? Bring your own coffee and come down and have a chat. We're big believers in, the KISS principle. Keep it simple, stupid. Like bring your own coffee and we'll just come and chat. And some people will bring baked goods. Some people will do whatever. I mean, it's just an excuse to get people together. But I would say,
Okay,
if you
so
don't
that's
remind
different.
people, if you don't remind, sorry.
So no, we actually provide treats.
Oh,
We
okay.
provide a host. So we have a host who goes down a half an hour early, provides the coffee, provides a treat. Actually books the room, sets up the tables, provides a coffee and a treat. So it's a little fancier. I don't think we can go fancy every week. Personally, I just like it to go every week on a more low-key basis. That's why I'm curious. And we do have a newsletter. Plus a mailing list. So I actually send out a reminder for the mailing list repeatedly. But the turnout has improved over the last few months since COVID. But I'm just curious how many you get and how frequently you meet. That's mainly.
Yeah.
Well, we probably get a turnout of 8 or 10 on Thursday nights. Depends what's going on. But again, Wednesday morning has kind of drifted off because we basically, because we're not sending out reminders, I don't think, because it was very popular at one time. And I think people, unless they're just like, oh, I guess it's not going on anymore because I haven't heard.
Yeah.
Okay, so you don't have a newsletter?
Well, we do.
Yeah, they do.
And it's a challenge. As I said earlier in the presentation, we found it to be a real challenge because it's a lot of work. Or maybe, anyhow, we're trying to figure out ways of doing it so that it's less work. And I mean, we put out a monthly calendar. I didn't mention that, but we have one person who's dedicated to sort of putting a calendar out once a month. And we kind of hope people print it out and put it on their fridge, sort of thing. So yeah, communication is really important, and I guess for us, some of it's kind of, when you think about it, like for myself, when I think about it, I post something on Facebook. I think we're finding communication to keep things going. You really need to bump that up a bit with a little bit more structured commitment.
So,
I mean, it's
so
interesting.
what we have is a mailing
Sorry.
list. We have a mailing list.
Yes.
It's
see
up to
what-
78 people now.
Oh, that's great.
And we have a newsletter which goes out to over 200 people every
Oh,
month.
that's great. Wow.
And then we print our calendars and post them on our notice boards physically. So we do all that, and still our turnout usually, our coffee mornings are usually 17 to 20.
Oh, that's
We don't
pretty
have,
good.
yeah, so that's actually not too bad, I guess.
Oh, gosh, yeah.
Yeah, the other thing I'm thinking about is that you mentioned getting a neighbor to neighbor, help each other with light bulbs or whatever.
Mhm.
We did have that at one point called condo care. The problem with that was the condo carers are all in their late 70s now and can't keep it up. So it hasn't actually gone far around the building, but we're looking into the possibility, and because you're beside us, there's an option of finding
Yes.
a handyman that you would pay by the hour, but a handyman who would be prepared to come in and do small jobs for people. We haven't found anybody, but there are people who run small businesses who might be glad of the contact. That's something we're trying to track down, because people do need these help, but the old guys who are doing condo care simply can't get underneath the taps anymore.
Yeah,
Or they never
Jean-
get back
Yeah,
out.
no, I hear you.
Gina-
I mean,
Gina
that's one of the
Gerry,
reasons we
you
want to
might
make
be
it
able-
intergenerational.
I'm just going to interject because Gina, and we've got more questions and comments here. So
Sorry,
Gina,
I'm sorry, I back off, sorry.
maybe you guys can connect, because that way.
Absolutely. I was just going to say that, Jean, I want to talk to you.
Okay, well, I've taken Jean's name down.
Because
I
actually,
just
we,
wanna know-
informally, we have met with people, Pam Churchill, we have met with people at Manhattan Place.
Yeah.
Again, if we can figure out a way of connecting with the 6 NORCs in this neighborhood, and then as a voice, we can maybe get some more, in condo care or whatever. I don't know, but obviously the
I
more
think-
conversation we have with the more people, the better off we are, I
I
think.
think, Gerry, you've made your first contact, so I'm going to
Yes.
move on here because we've
Thank
got
you.
a few comments and questions. Erica and Sheila Bryan, I know you have questions, so I'm going to come to you, but Marilyn, you've also made a really good comment, and Shoshana and Elise are here from the University Health Network, and I want to give them a chance to say something too. So let's take Erica Simon first, her question, then Sheila Bryan, then Denise, and I think Mary also has a comment. So we're going to go down the list. So Erica, next, please.
Hello,
Erica Simon.
hi. I just would like to know, where can we get the Directory of Services for Seniors and Caregivers, the booklet you mentioned, Gerry?
It's not in print. If you go on the website, maybe that's something, I don't know, Trish, if you can send out, I don't have that screen in front of me right now.
Yeah,
And
we can send out the link.
yeah, if you send out the link, but again, it's what sense does that make that you don't put those books, like historically, they had them at the public libraries. You used to be able to go to the North York Library up the street here, and they'd have a stack of them, and you could take one home. Then they got down to one that you could borrow, I guess, and so they just aren't printing them anymore.
Yeah, exactly. Sheila Bryan from Ottawa, you had a question?
Yeah, I'm just wondering if the LHINs are a good source to connect with community healthcare nurses or doctors who might be interested in being a NORC healthcare go-to. Anybody have a response? I don't know. I mean, I don't know any of them, but I just was wondering.
Yeah, Gerry, I might be able to jump in here. Sheila, I
Okay.
think Ontario Health at Home, I think it depends on what region you're in, to be quite frank, has been our experience.
Ottawa.
Yeah, there are some regions that are not great, and there are some regions that are pretty good. So I think connecting with the regional director is probably the best thing to do, is just check out Ontario Health at Home, contact the main number and say you want to talk to the regional director
Okay.
about that. And very likely they will respond, at least, which we found, which is good.
Great.
Okay, Mary, you've been chomping at the bit for a while to tell us about what's going on up in Sudbury. So Mary, can you comment?
Yes, I have a very bad cold, so if you don't understand me, that's the reason why. We have been operating as a NORC. We didn't even realize we were a NORC. And over 20 years, it's amazing what we've been able to accomplish. We started with a simple coffee break. Sometimes when we give people too much information, it's intimidating and they feel that they can't do all of this. So we started with a simple coffee break. We have 6 teams of, groups so that every 6 weeks, it's a different, they get a chance to do it over again. So it's not the same people all the time. We have an amazing number of events and programs. This is not a condo unit. This is just a regular apartment building. So there's a lot of changeover as well. So new people are coming in. So we have approximately 300 people involved in our building. We've grown to have a community garden. We have a tranquility garden because of COVID. Our landlord is on site. And he's very, very much involved. He has given us extra space in the building for our own activities. We've got movies every single Tuesday. We have darts, art. I can't even begin to tell you because we don't have enough time. We've gotten grants for computers, for iPads for our members. I can't, like I say, there's so much that we've been able to do, but remember, it's over a period of 20 years. So we're really proud of what we do. And I'll just tell you one little story. When people go to the hospital and return, we make sure the transition is as good as possible for them. So we pick up their garbage, they put it outside their door. We pick up their garbage. There will be somebody that will pick up their laundry and do their laundry for them. Now we have grocery delivery. They never have a problem getting to the doctor's appointment because we have a team here that provides us that. But there's a sign on the door of someone who just recently returned from the hospital, and it said, "Thank you for all the cards. Thank you for all the well wishes. Thank you for all that you've done. But please, no more food." So that's we look after one another.
Yeah.
And there's
That's
so
great.
much going on. It's incredible. And we've been I think we've had like 5 grants so far, successful grants with New Horizons, and we've just applied for another one because we're building an outdoor kitchen. And we've got neighbors in our community who are coming in. Some of them are immigrants, so they're going to teach us a few things, that we'll try planting a few different things. It's amazing, amazing what has happened in our community just because of this one building. You can't keep it contained. We've got a special event going on right now. We gave $8,600 to the food bank last year from this building alone.
Wow.
Like
Wow.
I could go on and on and on.
I know you could, because it sounds wonderful.
It
So
is.
Mary,
Thanks so much for that.
how do you go about like the whole grants thing? How do you go about applying for grants, and do they have to be bricks and mortar type stuff, or can you get a grant for a nurse or something, or like
we haven't tried that, but we do have we've had for the last 10 years at least an exercise program. We had a local chiropractor come in and assess our seniors because there are different levels of need. And so, now it's twice a week. We have trained individuals who come in and run an exercise program for our seniors, and they're actively involved. They're excited about it. They're standing and waiting for the door to be unlocked. It's just phenomenal. We have outdoor activities. We've hired bands to come and play for us.
Yikes.
That's
Wow.
fantastic. So what I'm going to do, Mary, is I'm going to hook you and Jerry up so that you
I'd
can.
love that. I'd love that.
That'd be great.
Yeah.
Well, I spent 20 years in Timmins, so I think I know that Northern Ontario, sense of community is a little different than living in my neighborhood now.
Definitely.
You miss that from the north.
But it's doable. It's something. it's something we can do. And you
Yes.
start small and don't overwhelm people. And
Yes.
and always communicate with you mentioned
Yes.
communication,
Yeah.
Gerry.
Yes.
Listen to what your people say. We started an art
Yes.
club. We had our own art show. It's amazing the talent in this building. It's phenomenal.
Wow.
Mary,
So how many
Mary,
residents do you
Mary,
have?
I'm gonna get you to do a
Okay, sorry, yeah,
presentation
we're
because
taking
I
over
think we
here.
need to hear about it. And
Yeah. I'd love to
the
talk to you
reason I'm
more,
moving
Mary.
on, the reason I'm moving on is that Denise Smith has something to say, I think, because they're hooked up with Sprint up in their area. Mary A has her hand up, and I still want to get to Shoshana, Elise, and Marilyn. So Denise, if you can just make your comment, then I'm going to go to Mary for her question.
Thanks. And I will just say to Mary that I have good friends in your building in Sudbury, so it is a small world.
Oh,
Um,
wonderful.
and we have learned from each other. I just wanted to make a couple of comments. I'm at Connections 400 at 400 Walmer in Midtown Toronto.
Oh, okay.
We used to be Oasis 400, and you mentioned Pam Campbell, Pam Churchill, and she now lives here in our
Yes.
building, Gerry. And so the community is spreading. I wanted to put in a plug for the NORC Innovation Center, and I know those gals are going to talk. They are making a list of all the buildings that are involved, and I'd encourage everybody on this call to get their names on the list. It's a really good way to exchange information. We need a central repository for what we're all doing and to learn from each other, and that's a really good resource. Communications, I wanted to comment on. We've been going for about 7 years now. We worked with initially our building management and Sprint Senior Care, which is a service provider of PSWs and other health and social supports in the north central Toronto, I guess you would say. It's been really helpful to have those partnerships. And the communications part, we started a newsletter early on. And as the newsletter writer, I know it's a lot of work. We use MailChimp. We have 179 members of our group. We're a multi-generational rental building. So we have about, maybe a quarter of the population are members. We have a full on schedule of activities in our seniors lounge. That room was provided by our building management, which was very generous of Great West Life. And we're lucky to have that space dedicated to us. We make really good use of it. We could use a bigger space and more hours, but we are filling it up. I think it's really important to work with your management, and that's different in rental versus condo. That's a really different dynamic, I think, that you have to recognize and work with. I'd be interested to hear from anybody who's using a different mailing or emailing program than MailChimp. We've recently incorporated as a nonprofit and are about to start charging fees. I'm heading our membership drive, and that's going to be a big transition for people, but we need some money to provide tea and coffee and whatever else to invite people. We do get a lot of drop-ins. We run those regularly. We also got a grant from the Retired Teachers Association. And the NIC, from UHN, provided a really good presentation on grant applications.
Oh, okay.
And the gals will talk about that maybe. I think it's archived on their website.
Yeah, and we're gonna get to them.
Okay.
I'm just pushing things along, Denise, as you can see.
Yeah, thanks. That's it.
Okay, thanks so much. That was really important for people to hear, I think. And we're gonna try and connect a few people up here, so and see whether we can get a little cabal going. Mary A, you had a question.
Actually, I have a partial answer for Sheila because I'm in Ottawa. And the Council on Aging, with lots of help from UHN and others, has put together a map of where all the NORCs are in this city.
Mm-hmm.
And now public health is using that map.
I saw it recently because I subscribed to the newsletter.
Okay, so yeah, so there are some connections starting. And I think it's up to all of us to tell our city councilors what's going on, because we need many, many more of these. My goodness, there's been some inspiring stories today, but we need so many more NORCs to be recognized as a viable solution to what city councilors are trying to solve. So we're on big effort to inform every one of our city councilors what's going on. We have 2 NORC supported programs in Ottawa, supported by the UHN. And that's a big difference, by the way. There are NORCs, which are just geographical collections, and then there's supported NORCs with programs
Right.
So are
Right.
you in Ottawa, Mary?
in Ottawa, yeah. So we need
Don't
more.
worry, Sheila, don't worry, I'm gonna connect you two.
Thank you.
But I will just say this to you all. So we are moving from our townhouse to an apartment the beginning of February. Mostly staff, seniors living there. I found out when we signed the lease, there's a bunch of folks that have a bunch of activities. So Trish, you know me. So I'm like frothing at the mouth to engage with these people to see if we can get a NORC.
Well, don't froth no more. We'll get you
Let's
hooked
talk.
up. I
Let's
just want to
talk.
point out, Sheila was with the Senior Liberal Commission and has posted some very good information about federal grants on the chat. So have a look. If you're
Okay.
looking for money, have a look there. The other thing is there was a question about, will the recording be available? Yes, it'll be on Seniors for Social Action Ontario's YouTube channel, and that will go out to everybody who registered for this session. So you'll be able to see a copy of the recording. And I want to give Shoshana and Elise a chance finally to say something. So Shoshana and Elise, if you're there, please speak up.
Hi, everyone. I'm Elise. Shoshana had to run off to another meeting. Thank you so much for inviting us and for just your wisdom around this. It's so amazing to hear that from the DIY guide, you've built this like huge community. And that's exactly the point of that work. So a couple of things. I won't be able to answer all of the questions that are coming in. The discussion is amazing. This is actually very similar to what we call NORC Talks, which is a gathering of folks each month to talk about issues like this. We have various presenters and speakers to talk about specific themes. So coming up on November 7th, we're talking about partnerships and how to build them and all of those kinds of things. So that's November 7th. What I will say for now, because there's a lot of information and we're sort of at the end of this, I'm going to pop in the chat here our Let's Connect link. So you'll be able to sign up for NORC Talks. You'll be able to sign up for our newsletter, which is set to go out this week. So if you sign up to subscribe to both NORC Talks and the newsletter, you'll get an invitation to NORC Talks as well as our newsletter. And I know that Denise, you mentioned the DIY directory. That's something that we do send out after coming to NORC Talks. And it is a great way for folks to connect with other people in their catchment areas or just in general. So my colleague Emma's also here on the call. I don't know if there was anything I missed, but feel free to jump in. But I will go ahead and add in the Let's Connect form. I'll also include my email address in case there's any technical barrier or whatnot, just to support you. And again, what an amazing hour and a bit. Like I have shivers. So
Thank you, Elise. And that's great. And that way people from all across the province can connect with Elise and get more information on how to get this started. Isn't it amazing what happens when we all get talking to each other, and how many connections get made? That's how things get done. We can't rely on the Ontario government. We're going to have to do this ourselves, folks. So I think this is a great start in doing that. Marilyn, we're coming up to the 3:30 end point. So Marilyn Dolmage, are you still there? I'd love for you to just add your comment because it was a great one. And I think it's something Gerry and everybody here needs to hear.
Yes, I just commented. I think people think that they I perhaps thought this was going to be a discussion about how to meet medical and health needs and focused on the problems. And I think what's really amazing is that it focuses on people's strengths and interests, which is what really brings people together. And I liked the comment about people coming home from hospital, for example. And the more you know each other, the more opportunity there is to celebrate those occasions and to keep them happening for people. And we know from the literature and everything else that services can be provided when needed much more effectively when people are already connected.
Yeah, absolutely right. And it's the connection that matters, because in the end, I mean, those are the people we want with us if we need some support, and are the people that we know the best. You know, it's great if strangers can provide some care, but you know what? The people who know us best are the ones who will bring us the most comfort at times like that. So, so Gerry, I want to thank you for a session that didn't just provide good information, but provided the opportunity for people to connect and also some inspiration. And Mary and Denise and others who added some things about your NORCs that have been going and what's possible. I think sometimes it's hard to know what's possible. So the fact that you made comments on these are the things that are possible, depending on what people want to do and how flexible the NORC model is to people's individual needs. I think those things are absolutely critical. So thank you, Gerry, for providing the catalyst for this wonderful discussion and for the information and the support that you've given us today. Really inspiring presentation.
Well, thank you. Thanks again. And you know, if there's any way or any more information anybody wants, our email address is uppermadisonlife@gmail.com. There's certainly people I would like to talk to more about, because again, we learn from each other. And you know, who knows where all this is going to take us, folks, but
it should be an interesting journey, right?
Sorry, well, we were the generation that protested, so don't mess with us.
Exactly, we get things done.
We get things done, and we don't take it.
Absolutely. Absolutely.
We're going to be sending out the slides, and I think the Gmail address is on the slides.
Okay.
And thank you so much to Elise and to Emma, is that who's here as well from UHN, for your interest in this and for your support of all of this, because it means a lot, I think, to people that UHN has been such a catalyst as well. So thank you. Okay, I think having said that, I'm going to bid everybody adieu until the next one. And can I put in a plug? The next Zoom session is going to be a wonderful guy by the name of Ray Applebaum, who's going to come and talk to us about the hub and spoke model that PLC Link has going in Peel, that's keeping hundreds of people out of nursing homes right now. So I'm sure you're all going to be interested in hearing about Ray. So watch for that. I think, Harry, I've forgotten when that's going out, but I know you're in charge of that. So that will be going out probably this week sometime. So watch for that flyer. And thank you again, everyone. And thanks for the great comments and for all the supportive work that everybody's doing on all of this. So take care. And
thank you. Thanks again.
Okay. Bye-bye.
Thanks for your interest, I guess, too.
Yeah, absolutely. Thank you, Gerry. Bye-bye.
Okay. Bye.
Bye, everybody.